Hi, Dr. David Stoker, board-certified plastic surgeon in Los Angeles, with one of my patients who I met probably 15 years ago. I've done different surgeries on over the years. She's a mom, and she's here today for facial rejuvenation, or a pre-op visit. I just wanted to review this case with you guys. We're going to do, first and foremost, a lower facelift and neck lift. What that's going to do is really tighten up this area down here, and then the lower facelift will help this area over here. She's an excellent case for buccal fat pad reduction. That's that extra fat in here. Some people carry their weight in their cheeks, and she is one of those patients. Through the inside of the mouth, go ahead and open up. Through the inside of the mouth, up in the cheek, I make a little incision, and I'm able to pull out part of this. Go ahead and close, which will give her a more angular look down here. We're going to do an upper eyelid surgery. Go ahead and close your eye for me, Yolanda. So this little extra skin right here, we're going to remove along with a little bit of fat and muscle. Go ahead and open for me. See how she's got this lateral fullness that gives her a little bit of a kind of sadder-eyed appearance? When we remove this skin right here, open it up, it gives her a much brighter-eyed, kind of happier appearance. Her lower eyelids are a little bit tricky because they're pretty deep set here. There's a kind of a deep fold in a crease, but not extra fat. There is extra fat down here, but not on the eyelid. Go ahead and look up at the sky for me. So what I'm going to do is a fractional carbon dioxide laser. I love this treatment for this type of situation where I get fairly close to the lash line in this area, and it tightens up that skin, but usually in a very very natural appearing, much lower risk way than if you did that surgically. So it's kind of the state-of-the-art way of treating that lower eyelid in my mind. And then lastly, we're going to do fractional carbon dioxide laser over central face in chest with platelet-rich plasma, PRP. The laser is going to be very helpful at wiping away the sun damage here, tightening the little wrinkles that are around her mouth here, and getting rid of, or let's say reducing a lot of the sun damage that's on her chest. She's done pretty well, given that she's been out on the lake and the ocean quite a bit in the last few decades, but good job wearing the sunscreen. I'm super excited for you. It's going to make a big difference. Today we're here for the pre-op. We're going to get her started with our esthetician, make sure she understands all the appropriate skincare regimen to do this procedure. And I have one question for you, Yolanda. You went to your internal medicine doctor. I know, even though I've operated on you before, we've known each other a long time, you wisely got several consults from skilled plastic surgeons. What did your internist say to you?
He said to choose you. You were one of the best because you worked on his wife, and you're just wonderful, and I trust you. That's all I can say. Oh my God, I'm nervous.
I love that. Well, you can be sure. It always makes me feel great when the doctors send their wives or come to me themselves. It's a cute story. Thanks for sharing that. I'll take great care of you, that's for sure. Okay?
I know you will.
All right.
I know you will.